everyone, I'm Princess.
And I'm Jazmin.
And we are
White Coast Stethoscopes. And we just finished our first year of nursing school.
Okay, little dance.
We back. All right, so we just finished our first we are in an accelerated program year-round. We just finished our 5-5-5, which consists of ICU, maternity, and pediatrics. So the classes are normally 15 weeks long, and they made it 5 weeks for each class. So it's very fast-paced, exams every Monday, and we just survived. So we are so happy, and we just survived our first year of nursing school.
We are excited.
Yes.
So now we are, we have 3 weeks off. I mean, to us, that's something amazing.
Mm-hmm.
But we do start school back soon after the 3 weeks.
Yep.
But pediatrics was very, very stressful. It was very, very hard and difficult. Like Jazmin said, we have exams every Monday. Plus, on top of that, we have clinicals. We have EAQs we have to do. We have to study. And this was different. This class was different because we didn't have lecture. It's more of
Podcasts.
Yeah, podcasts and PowerPoints. So that was hard. We basically studying on our own and teaching
yourself. And then what also made this class difficult is that you have to learn the different developmental stages for the kids. So what is a 1-year-old supposed to be doing? What is a 3-year-old supposed to be doing? They should be able to ride a tricycle. They should be able to, draw a circle.
Yeah.
And a 4-year-old should be able to hop on one leg.
Yeah.
But we can tell you how we study for that because while I'm saying all of this, I'm picturing the images I was drawing so I can remember. So we definitely can talk about that, how we survived this summer rotation. I am so happy and proud of myself.
Yeah, we did a great job.
I'm proud of us.
I'm proud that we survived because it was hard, really hard. I say one thing about pediatrics that I really enjoyed. Instead of going to clinicals in the hospital, I was able to go to camp. So I went to camp for 5 days. I went to arthritis camps working with kids that had arthritis. So that was very interesting to learn about the different arthritis that the kids have, and then how they deal with it, how they deal with their peers, and how the family members deal with it. So that was interesting, something that I did and I really enjoyed doing.
We were in clinical together. I didn't do any camps, but I actually loved my clinical sites. I learned so much about doing tube feedings. What else did I do? I did tube feedings. I was setting up IVs.
Fluids.
Yes, fluids. I did a nebulizer treatment, which I thought was cool because normally respiratory therapists do that, but they allowed me to do that, and I thought that was nice to just experience. But clinical was cool. It just was really just focusing and studying every week and knowing that you have an exam next Monday on something totally different. It takes a lot to be in nursing school and to survive nursing school, and I'm just so glad that I have a friend like Princess, and we have many other friends that we do want to introduce to you guys later on our channel that has helped us survive, and they can tell their stories as well. But we're ecstatic.
We're excited. That's why we're smiling.
I'm just so happy that I made it through my first year of nursing school. I didn't think I was going to survive.
Yeah. And people might ask us too, do we like pediatrics? Do we work in pediatrics? For me, I love working with kids. I love working with kids. I love kids. But pediatrics, I don't like seeing kids hurt or in pain. That's the only downfall of working in pediatrics. Seeing the kids in pain or hurt and the family members sad or upset. That's the only thing about pediatrics. Just seeing the babies really in a lot of distress and stuff like that.
I could say that too, but then I also did at first I was I am so anti-pediatric because I'm not really into kids. But I'm not. And then, but I did like it because we worked at a hospital that was a children's hospital. So they had sometime Pixar come. Our first day, there was a pony.
Oh yeah.
So they were doing pony rides, and I just loved interacting with the patients. They're just so I would say that Princess and I both are very childish. So it was fun to just be able to still be show our inner kid as well, and just interact with these patients and like they were able to interact with us, like, oh, you're watching Ninja Turtles. I love Ninja Turtles. Like, let's talk about Ninja Turtles.
What floor? We were working on our
rehab floor.
Yeah, rehab floor. So this is like helping them get better, doing physical therapy, speech therapy, you know, stuff like that. And a lot of our patients were in like severe like accidents too, and so that was like just something different. It was really just sad seeing that, but then seeing them improve, I think too, and get better. I think that was great and amazing to see that, especially for our one patient we had, the first one. Yeah, can't say no name, but
right, he definitely improved. HIPAA violation, so we can't say that.
But it was great to see that he really got better, and you know, soon was going to go home.
So that was a plus. So that was our clinical experience. What else can we talk about?
Our professor experience, it was different. Like we said, it was like no lecture. So that was just hard because we had these podcasts. And so each week we might have, I think 4 or 5, sometimes 8 podcasts that last over 30 minutes. So you have to balance like studying, like Jazmin said, studying the PowerPoint and listening to these podcasts and trying to get the information. And then on top of that, we have like these EAQs we have to do or case studies. And, you know, Jazmin had talked about the EAQs. It's like questions that we do to help us prepare for the NCLEX. But we have to do so many of them, and we have to level up.
To level
2.
And complete at least 300 questions.
So that's a lot on top of studying. And plus, the case studies is like they give you a case study, and then you have to answer questions on top of that. So it's just like things like that. And depending on what clinical instructor you have to do care plans or concept maps, you know. So it's just a lot of things that goes into this 5 weeks. I would say that was really stressful. And sometimes we don't have a life, but it's okay.
We don't have a life.
We don't have a life, but it's okay.
We're just now starting our life. And like we're saying we're going on summer break right now, and people are going back to school. Like this is crazy, but we are happy for this like 2.5 week break. I just don't want to see anything related to nursing. I'm not gonna lie to you guys.
So we're gonna go on break. We're gonna relax. We're gonna enjoy our time, the sun, the weather.
Yes.
And I want to say to Jazmin that I wouldn't have made it this far without this girl right here. I really wouldn't have. Like this is like we're so close.
No, seriously.
No, we're really close in this program. Like it's crazy how we met the first day, and like that we clicked.
We met. It was funny.
It was funny how we met. And
I asked her, I was like, girl, they got any water? Right when I came in, there was no water. There was only coffee, and I don't drink coffee. And I was like, no, she had some water.
Oh, yeah.
And I was like, where'd you get that water from? Because there's no water back there. And we just clicked from there, and then she ended up going to the same high school I went to. But we met through nursing school.
And we've been close ever since. And we have other friends, but we are, I would say, we're getting close.
Yes, we are.
Yeah.
So I couldn't have made it without Princess either. Like, she definitely helped me in our psych class, like when I was crying, and I was just, it was just a lot because I could not do psych.
Yeah,
psych was not for me.
You do have those moments where you may not tell people, but you do have breakdowns.
Was that psych? Okay, that was psych.
Yeah, that was a hard semester. But you do have times where you break down and you go through a lot, just emotional things, and you don't tell people, but you get so close with your cohort and the people you meet that you tell them. You might call them and be like, I need to talk to you. I need some advice.
Or like, how are you doing this?
Yeah.
Quizlet is your best friend. Okay,
how do you study? How are you giving the A on exam? You know, so it's just like helping each other out. Like, I don't want to leave none of my friends behind. Like, if I'm no one left behind. If I'm making it, you making it. I'm not the type of friend that's just, okay, I'm making it, I'm going to just leave you behind. Like, if I'm going forward, you're coming with me.
And that's what I like about our cohort. Like, we are all very, like, I would say close-knit when it comes to just teaching each other how we're figuring things out. Like, if somebody may be an expert at doing, like, a concept map, and so you're going to be like, all right, I'm going to talk to them. And then tutoring. I feel like some people are ashamed of going to tutoring, or they feel like, oh, I have to go to tutoring, like I'm not doing it right, or I'm not smart enough. And I love my tutors, and I love them so much because they have helped me make it to surviving my first year of nursing school.
That math.
Woo. And y'all would think that math is not difficult, but this math, man.
It's difficult. It's hard. It's hard.
You want to make sure you're not overdosing your patients, so that rounding gets real tricky. But me, I fight everything, okay? Like, I'm like, we were taught if it's 5 and above, you round up, okay?
So don't be ashamed of tutoring. Now to say that, which I can say, do not be ashamed of tutoring. We're not ashamed of tutoring.
Right.
And
don't be ashamed of speaking up. Speak, like literally speak up. Like nobody will know that you're going through anything if you don't speak up.
Yeah.
And I love our resources at this program. Like we have tutoring available. You can do you can do counseling. You can do Skype tutoring. Like if you're not able to make it to the campus. So I just thought that was really helpful within my first year.
Yeah.
This has really turned into like a pediatric / our first
year
of nursing school. Like we mixed it together, but
like that's do not be ashamed to tell somebody what's going on, or if you need to talk to somebody. Like she says, great resources here, and even your cohort, like they're there to help you through anything. Like I don't think our cohort would like talk bad about you. They would help you and guide you if you need help with anything. That's what I love about my cohort. Is that
so? What would you say? Like, what would be something that you would say to like yourself if you knew what you knew now about nursing school? Like, what is something that you would want to teach other nursing students that are maybe going into nursing school?
I would say to like ask for help like right away. If you're struggling right away, ask for help. Because I think too that was like my main downfall our first semester. You ask for help, but I think when you ask for help so late, it kind of hinders you. So I would say ask for help right away.
Definitely, and read that syllabus and make sure you are understanding everything. Like how we said in our previous videos about the 73% and how we thought that we were passing, and we really had to pass like our last exam to pass. That was something that wasn't really explained like correct in our syllabus, or maybe we read it wrong, but definitely ask questions. That's something that I would say is ask questions, and definitely get in that tutoring like as soon as possible.
And you know what else thing I would say? Asking for help, get a planner.
Oh, I love my planner, Erin Condren. If y'all watching this, Erin Condren, you can definitely ask me to be a student brand ambassador. You know, trying to get that.
But get that planner. Planner is your best friend, and I say write everything out. If you have to go get your car wash, food, clinicals, you got this to do, write everything out. Like that planner helps you. I would say get a planner.
I didn't use it for summer.
Girl, I didn't use it for summer.
Yeah, I didn't use it for any of summer, but I'm going to be back for fall. I'm definitely using it again.
Fall and spring I didn't, but
I had no time in writing my planner for this summer.
Not this summer, but get a planner. It does help. It does help you. Get a planner. It will help.
What else should we say? I can't talk.
It's been I would just say it's been a great experience these 5 weeks. I learned a lot from myself, from friends, from staff members, from professors, from family members, just from life. I don't know. I just learned a lot, I think, through these 5 weeks,
And talk to your professors. Like Princess and I are so just like goofy, and we're basically showing y'all our true self in this
Everybody
video.
knows us.
So we make sure that clinical faculty, staff, everybody at our program knows us, and we try to build like great relationships with them and just tell them what's going on, and just keeping like that positive energy. Like that's something that I am still learning right now, like just to remain positive, like everything's going to be okay, and just knowing that people are there to help you. That's something that I would say is just remain positive. If you attend church, keep going to church, keep reading your Bible.
Like she said, the professors are here to help you and support you. Like if you're struggling, like I said, ask for help like early, and they will help you. I mean, they'll push you, they'll guide you in the right direction. So I would say
office hours, best friend. Office hours are your best friend.
But I would say we learned a lot this first year.
Oh my God, we really survived our first year, y'all. Like. We are taking, hooray. We are taking our, we get pinned this December, so that's going to be exciting. Yes. And what else? We can sit for NCLEX, like basically in January.
January.
And then what else? Princess will be leaving me. Our cohorts are about to split, in January?
Yeah, so basically, so you want to talk about that? Like, how we split. So, I'm case management. Jazmin is
family nurse practitioner, F&P.
So we split in January. So they'll go like F&P route, and I'll go my case management route. And I graduate fall of 2020.
And I am December 2021.
And I will miss this girl. But
Yes.
we'll still do our YouTube channels together.
Yes. Then y'all gonna really see her in her white coat, okay? Because she's gonna be professional, okay? And I'm still gonna be in these scrubs. Or maybe I'll have some nice scrubs, like these Samuel Merritt ones. They cool, but you know.
Yeah. So we split, and our first year we're together for a whole year, but then we split, and now it's gonna be sad because she's gonna leave me.
She's leaving me. She's the one about to graduate and stuff.
So I guess when we start that program, we'll talk more into like family nurse practitioner, case management, and you know,
and like the differences that we're experiencing.
Mm-hmm.
And we're so excited to have you guys and the people who subscribe. We really appreciate you.
Yeah, we do. Thank
the people
you.
who follow our Instagram channel. We appreciate you guys
Yeah.
for the love, the comments, the support.
Yeah.
And our cohort, like, we really love you guys.
We love you guys.
And we're so proud that we all finished our first year. And thank you guys for just being like, I love your YouTube channel, or maybe talk about this.
Yeah.
Like, they're giving us a lot of advice.
Or
so.
yeah, just give us feedback,
Mhm.
what you want to see, what you want to hear.
Mhm.
We just did this YouTube channel just to, you know, give people like more insight of nursing school, more insight about ourselves, and how we, you know, deal with just family, friends in school. So whatever you want to hear, let us know. We'll talk about it. We'll bring more of our nursing friends here, and they'll talk about things they go through, challenges they, you know, deal with. So
We're
just
so excited. But we'll definitely get back to you guys. Once we're back in fall, we will be having community health, our preceptorship, yes.
Stop clapping like that.
She's still clapping. Our preceptorship, and what else do we have? We have leadership, and then that's when we're taking our HESI exit exam. So
Yes.
please pray for us, and just be there to support us.
Yes. So we're going to end the video now. Thank you for watching
Yes.
and subscribing. And we'll leave below our personal Instagram, me and Jazmin's personal Instagram, and also our White Coats and Stethoscope Instagram also.
Yes, so
below.
please like, comment, and subscribe.
Bye-bye.
Bye.